Hello everyone, my name is Bernadette Richards. I'm a master's student with the Psychology and Human Development Department at UCL. I've been an education professional for 20 years working with individuals with special needs and mental health issues. About a year ago, I started observing closely the help-seeking behaviors of young adults in a college setting while interacting with them. I became interested in their mental patterns about life and how they looked after their well-being. What I observed got me interested in wanting to explore the understanding of mental health and well-being of college students. Today, I will take you through the process of my study, highlighting key implications and areas for further research. Latest mental health statistics reveal 1 in 5 young people aged 16 to 24 in the UK report some symptoms of anxiety or depression, which are the most common mental health challenges in young people in the UK today. However, despite these statistics, there appears to be a lack of evidence reflecting the level of mental health awareness and well-being in college students. This study aimed to explore the understanding of mental health and well-being of this group of students as viewed by them, with recommendations for strategic interventions to build resilience and well-being. This UCL IOE-approved exploratory study employed both quantitative and qualitative methods. Questionnaires that measured mental health understanding, well-being, and resilience levels were used. Free text boxes at the end of each questionnaire enabled verbatim quotes to enhance the research and validate the findings. I'd like to highlight some key findings that emerged from the research. The mental health scale presented high scores, indicating a good level of understanding. There was a significant relationship between mental health and social resources, suggesting the existence of strong family bonds and reliable friendships. The moderate negative correlation highlights possible over-reliance on social resources in trying to develop self-coping skills. The correlation between mental health and structured style reveals a trend on adaptability, perception of change, and flexibility in how life's changes are managed. High well-being scores were obtained. However, the standard deviation scores suggest a broad range of states of well-being, and this needs deeper exploration. Correlation was significant between well-being and self-perception and social resources, suggesting how individuals viewed themselves and how they perceived others viewing them influenced their well-being. It is integral to consider the interplay of variables in this multifaceted construct, since one positive indicator does not necessarily suggest well-being in other areas. High resilience scores were obtained. However, the large standard deviation requires further examination, suggesting some of the coping strategies may only be context relevant, needing consideration for wider application. Overarching ideas that emerged through frequency of responses were anxiety, motivation, perception, self-perception, trust, and understanding. Four key recommendations emerged from this study. Firstly, implementing cognitive outcomes-based interventions. Secondly, delivering structured and unstructured clinics, having a designated mental health lead to ensure mental health support based on good evidence and well-timed referrals. Next, developing a mental health policy. Lastly, extending a wider and collaborative support network with parents, carers, and other agencies. Further research can explore a variety of colleges in the UK with different demographics and geographical locations, analyze the effectiveness of outcomes-based interventions on the college population, investigate the types of training that benefit staff to ensure that mental health and well-being issues are addressed at college. In conclusion, this study evidenced that while mental health understanding among college students in the UK is strong, there is a need for maintenance of well-being using resilience as a building block. We've now come to the end of my presentation. I hope you've gained some meaningful information from this. If you would like to discuss this further, I've included my contact details on the slide. Thank you for listening.